Good afternoon, everybody. So I saw one guy from Japan. I think it's early in the morning in Japan. So I'm very happy that you can attend our webinar. So I would like to welcome you to this webinar series on behalf of the Ideal Group. And you see the whole Ideal Group, the work package leads, here on the picture. It's I start with Gosia, Małgorzata Bogdan, Professor Bogdan from Warsaw University, Karl Frederick Burman from Chambers University and AstraZeneca. We have Holger Dette from Bochum, myself. We have Mats Carlsen from Uppsala University, Franz König from Vienna, Christoph Mahle from Vienna University, Franz Montre from INSERM in Paris, Gert Molenbergs from Leuven University, and Steven Sen from Luxembourg Institute of Health. So this is only the group of PIs of the Ideal project, but we have more than 10 research assistants who are doing the work and who are doing the research by their own. But details I will give you in a few minutes. So let me start with a brief bio sketch of myself. So who I am, my name is Ralf-Dieter Hilgers, and you see me on the screen as well as on the transparency. I'm the head of the Department of Medical Statistics at the Ralf-Dieter University, that is in Germany, and I'm the coordinator of the Ideal project. So I studied mathematics at the Ralf-Dieter University a long time ago since now. Then I got my PhD at the statistical faculty of the University in Dortmund, that is also in Germany. And since 2001, I'm the head of the Department of Medical Statistics here in Aachen. I have research interests, and they cover optimal design of experiments, as well as randomization procedures and clinical trials. And I do have a lot of experience in teaching and in consultation medical students and medical researchers and statistical methods. So that's more or less about myself. And now I go to the next transparency and tell you if you have any comment, then please use this chat button, as most of you already did, and write your comments, and I will ask any comments or question you have during the lecture or during the next lectures, as best as I can do during my talk as well as after my talk. I think today we don't have to fill a whole hour for the lecture. We will have maybe half an hour, so there might be a lot of time to pose questions or to prepare yourself for the next lectures. Okay, what is the webinar about? So, well, I think that most of you are not familiar with the Ideal project, and names are the one thing, but topics are the other thing. So I will present you an overview of the Ideal project, what is it for, and what is the background of, and so on. And then I will give you some more technical aspects, and I will introduce the lectures of the webinar series. And that's all for today. Okay, so let's go on. The Ideal background. So, well, when you're facing with clinical trials, the standard methods might fail to work if the sample size is very small. So in this situation, there's a need to integrate a broad range of innovative methodologies improving clinical trials in the setting of small population groups, for example in rare diseases or in subgroup analysis also. There are a lot of examples. The objective of this research is to produce methods of general applicability irrespective of the medical indication. And we follow an integrated I'm very sorry. I got disconnected sometimes, and so I hope I'm back again. Well, we are on the background of our research, and the objective of the research is to produce methods of general applicability irrespective of indication by integrated design and analysis in small clinical trials through a multidisciplinary, closely collaborating consortium of researchers from Europe, and they are from universities, research institutes, as well as from industry. Okay. Well, this idea needs some funding, and the EU funding initiative was set up by the European Commission in 2013 within the 7th Framework Program Health. And they set up a call which is called New Methodologies for Small Population Groups. And the objective of this is to develop new or improved statistical design methodologies for clinical trials, aiming at the efficient assessment of safety and or efficacy of a treatment for small population groups, in particular for rare diseases or personalized medicine. So the there should be a multidisciplinary framework involve all relevant stakeholders, including industry, patient advocacy groups, as appropriate. And I will show you in a minute how we do this. Ideally, the results would lead to an improvement of the clinical trial guidelines in small population groups and mostly on the EMA guidelines in this respective. Also, it is a CPNP guideline as well. The collaboration with relevant stakeholders outside Europe is welcomed, and we did all this as well. The expected impact are cost-efficient clinical trials, which aiming to derive reliable research from clinical trials in small population groups. Okay. So what is IDEAL now? Well, IDEAL is funded in this framework. IDEAL is one of 3 funded projects within this framework, call, and the abbreviation stands for Integrated Design and Analysis of Small Population Group Trials. IDEAL aims to refine the statistical methodology for clinical trials in small population groups by strictly following the concept of an improved integration of design, conduct, and analysis of clinical trials from various perspectives. Well, there are a lot of people involved in our IDEAL project, and here you have a picture of people meeting in Paris in November 2014, so 2 years before, and we have another annual meeting last year in Leuven, and we will have another annual meeting in Vienna at the beginning of November again. Maybe you know some people which is shown on the picture there, and then you will identify there are people from European countries as well as outside European countries. And you will see people having different backgrounds, and I will come to this in a few minutes again. Okay, somebody gives me a reminder that you can't see me. I hope you can see me now. Okay. Well, to be a little bit more detailed, I will show you the European map, and you can see there are 10 different partners from 7 countries. So we have partners from Sweden, we have German partners, we have partners from Belgium, and we have a partner from France, from Luxembourg, and from Vienna, which are in reality 2 partners there. Okay, so the team has a big work package to do, and the work program is divided in 11 work packages. And you see that the number is starting by 2 because work package 1 covers the management of the project. Well, I will briefly go through the list. So work package 2 is about assessment of randomization procedures. Work package 3 about extrapolation, dose response information. Work package 4, adaptive design studies. Work package 5, optimal design in mixed models to analyze studies in small population groups. Work package are the slides not visible? That's not a okay. Okay, if you can see the slide, then that is a particular problem of somebody. Okay. Okay, so we have work package 7, which is about simulation of clinical trials, work package 8, genetic factors influencing the response to the therapy, work package 9, decision analysis, work package 10 is biomarker and surrogate endpoints in small population groups, and work package 11 is dissemination. You see a lot of areas which are covered. And this group is accompanied by an external advisory board. And this advisory board covers people from all over the world. And we would like, if you have the call in your mind, then you know that we have to include a lot of input from different areas. So we have some people with a strong medical perspective in mind, like Ségolène Aimé, number 1, or Gérard Pons from number 12 of the advisory board, both from France. And Gérard Pons also covers aspects of the regulatory perspective, which is also clearly held by Ralf Herold from UK. So we have some people covering different strong math perspectives, like Rosemary Bailey, who is an expert in optimal design theory, and we have Christopher Jennison, who has strong expertise in sequential designs. We have Bill Rosenberger from Fairfax University, who has strong expertise in randomization and design. We have Gerhard Wassmer, who has expertise in adaptive design. Tomasz Bruzikowski, who has expertise in mixed models. We have Stephen Julius, who has expertise in design of experiments with special interest in sample size. And we have Chiara Sabati, who has expertise in genomics data, bioinformatics, and these things. Then we have the industry perspective on board with Frank Breitz and Paolo Baroli. And we have the health economic aspects on board with Martin Foster and Paolo Pertile. And we have the patient perspective with Jaran Nguyen. And last but not least, we have the ethical perspective with Günther Schmalzing. So you see a broad range of people who are in the external advisory board, and we have very nice and very fruitful discussions with them, giving input in our research from various perspectives. The structure of the project is like the following one. Oh, it's along one direction, and now you see the connection between the names and the work packages. We have some people working more in the prior information part, and some people working more in the design optimization part. And then we have work packages who are the link between these two parts. And among the people who are working more in the prior information part, we have simulation of clinical trials, which is done by Mats Carlson with this Uppsala group. We have Malgorzata Bogdan, who is selecting genetic factors from Warsaw University, and we have Fred Molenbergs, who is looking for validation of surrogate endpoints and so on. And we have people who are working more in the design area, that is Franz Monfray from INSAM in Paris, who's working on optimal design and mixed models, and Carl Frederick Bormann, who is going also in the direction of the analysis. Well, that should also cover the prior information part. He's doing decision analysis approaches. And more in the linking part, in the middle part, are the assessment of randomization procedures, my work package. Holger Dett is working on extrapolation and dose response information. Stephen Sen is working on design of pharmacogenetic trials, and adaptive design studies, which is done by Franz Grimm. And all these work packages and these design areas are in the interest of the EMA, of the European Medical Agency. They, some time ago, put this green parts on the left column of the table to our interest, and we see how this relates to our work packages. So, for example, you see the extrapolation part and the standard of evidence, which is covered by work package 3, Holger Dette's part, and Franz Koenig's part with adaptive design. You see the data-driven decision-making part, which is clearly in the topic of Carl Frederick's work for decision analysis. We see the understanding of value of research, which is covered by what is in the research of work package 6, which is done by Stephen Sen. We see multidisciplinary simulation, which has done the simulation of clinical trials and the optimal design part from mixed models done by Mats Carlson and Franz Montré. And also we have effects, bias, and randomization. And these parts are given in work package 10 and work package 2, work package 10 from Kurt Molenbergs and work package 2 from myself. So these areas here are almost all covered by the EMA guideline as well. So the EMA guideline on small population clinical trials. So what did we do up to now? Well, the ideal schedule said you have 3 years time, so 36 months, and we have 2 reporting periods, and the first reporting period ended up in the middle of last year, and the second reporting period ends up in the end of October this year. We have 6 milestones, and we delivered, you see, 40 deliverables to the Commission to visualize our work and to bring our work into concrete answers. But to be more concrete, I mean, the deliverables are not public up to now, but they will be public. More interesting for you is look to our webpage, because then you can see that we have almost all 35 publications in peer-reviewed journals. That is the actual state. And I must say there are 2 already accepted, and there are a lot of other papers who are under review are immediately going to the journals. So it's good for you to have a view to this. We have presentations at various conferences, and also we have a presentation held at the FDA. We have done workshops at different conferences, organized conferences and session at conferences. We have released various free available software programs. Also in this direction, have a look to our webpage and look to the CRAN webpage as well, where most of the software is published. We have done input to regulatory guidelines, and we have a nice program. Our research assistant, part of our research assistant, had stayed abroad. So visited people from the external advisory board, get some new ideas from there and bring them at home and continue doing their research. And this part, this last part, is I'm very proud of this, because this is not in the funding. This is extra work. But I know that some of us, in particular me, have done some input to design and analysis of rare disease clinical trials. Some of them will be funded in the next time, and some of them leads to publications as well. So we are in concrete, involved in concrete projects already, and we support the physicians in doing their work and apply our new methods over there. We have a big network. So meanwhile, we had a close collaboration to the other two projects. That is the Asterix project and the Inspire project. Asterix project is coordinated by Kit Roos from Utrecht University, and the Inspire project is coordinated by Nigel Stellett. Here you see Kit and here you see Nigel, my good friends, because we started some collaboration, and in an incredible short time we made a position paper and published this in the mid of this year in Orphanet about how are the research areas and which are the research areas for the two projects we would like to cover and we find that are interested for small population clinical trials. Have a look to our webpage, you find it immediately. We three are involved in the steering committee of the International Rare Disease Research Committee Task Force on Small Population Clinical Trials. And this process starts already at the end of last year, I think, and we had in March this year, April this year, we had a meeting at the EMA where all the people are having a big discussion at the EMA, and we finished a position paper, and I think the position paper will be published at the end of this year. And we have strong contact to the European Medical Agency, the EMA, via our advisory boards, via Ralf Herold, via Christoph Mahler, via Franz Koenig, and so on. And we will have a joint meeting, and I come back to this in a few minutes, next year. And we also initialized a small population working group at the Drug Information Association, where some of our people are involved. And this picture is our nice Vienna workshop we had in 2014, and where all the three projects met, and we had big discussion there and started our collaboration over there. Okay. Now I come to the next part, the interesting part, because we are not finishing next month. The European Commission said, okay, you can prolong the runtime of your project to do a joint research meeting at the EMA next year, and it is scheduled for March, I guess. The date is not fixed at the moment. And the aim of this EMA workshop would be that IDEAL, Inspire, and Asterix would bring out a synthesis, a joint statement about their research, because it's not good to have some research finding on extrapolation from IDEAL, some other from Asterix, and some other from Inspire. We want to combine that. We want to write a paper so that you as an applied people can see which method I may think about when I do something which is in the area of extrapolation or which is in the area of randomization. So 2 additional deliverables for us without getting any extra money, but I think it is worth for you as applied people to be aware of this. Okay, that's all for IDEAL, and let's go to the webinar series. So what is the intention of the webinar series? Yeah, you see from the list of participants that I would like to inform the stakeholders about the new IDEAL methodologies, the new arrivals we made, the new achievements we made in work package 2 to 11. And this will be presented by the work package leaders, and I will show you the timetable just in a few minutes. And the last webinar will be a joint presentation of all work packages, more oriented to what we did in dissemination activities and what you can have. Okay, what are you going to expect? Well, The webinars are around 1 hour, but we try to do this in 45 minutes so that there is enough time for discussions. Usually they will be 5 to 6 p.m. at Central European summertime, and you must be aware that in October the summertime changes in Europe, so there might be a different time. But we will announce this early enough. The webinar series is free and open for everyone, so you will not be charged for that. The slides of the webinar are published at our webpage, and you see the webinar is recorded, so you may hear my voice again and all the noise which are from technical stuff here. And if you have any questions in the future, not only in the webinar, in the future as well, do not hesitate to contact us. We are very happy if you will contact us and we can answer your questions. So let's go to the timetable. So today we are on the 4th October, and I will give you the introduction to the webinar series. On Thursday, I will report about selection of a randomization procedure. Does it matter? How it works. That's the findings of work package 2. On the 11th of October, Mats Karlsson from Uppsala University will talk about a sampling importance resampling procedure for estimating parameter uncertainty, and he will show how to do this, to do something which we call simulation of clinical trials. Then on the 13th of October, Holger Dette will talk about statistical inference for the comparison of small population groups, which is related to the extrapolation work package. Then Gert Molenbergs, who is doing the research in this area of biomarker, will give his webinar in pseudo-likelihood and split sample methods in small and very large studies. Franz Koenig will continue on the 20th of October with adaptive level evidence, and Stephen Sen from Luxembourg Institute of Health will continue on the 25th of October. A little bit me, a little bit you. NR1 trials, random effects, and shrinkage estimate as his title. Then on the 27th of October, you will hear Franz Montré talking about using Hamiltonian Monte Carlo to design clinical trials with longitudinal data. On the 10th of November, this is after the change of the time in Europe, Margosha Bogdan will identify genetic factors influencing important patient characteristics. And then we have on the 15th of November, Carl Fredericks talk about optimal decision and stakeholder interaction. And on the 17th of November, Christoph Mahle and Franz Koenig will show you our dissemination activities. So that's the program, and I hope you like that and find some interesting points for your work. So you can keep in touch with IDEAL, and I would like to recommend looking our webpage. Here you see the webpage, www.ideal.rwth-aachen.de. You can get in contact via LinkedIn, and here is our group. And we have some followers already there. And you can also follow us on Twitter, where we have a Twitter account, and we recently do a lot of things in this area from the group. And that's almost all done. At the end of my presentation for today, I would like to thank you for attendance, and I would hope you enjoy the webinar series, and I hope that I see most of you on Thursday when I talk about Work Package 2. So that's all for the moment. Thank you for attending the webinar, and hope to see you. So if you have any question, please answer your questions now, and I will try to answer this immediately. I'm just waiting 5 minutes so that you can think about it. But it's more organizational stuff at the moment, so maybe if we go more into the research topic, you would have more questions at that point. Yes, the web page, you find that on the web page. If you go on the web page, www ideal, yes, that one, and then you go on output, and then you find the publications, and most of them are linked behind the on the web page, so you can get direct access to them. But in case you don't get access, please write an email to me, and we will send you the publication in that case. Okay, so in case there's no further comment or further question, I would like to thank you again for questions and for watching our webinar. And I would say bye-bye and see you on Thursday. Bye-bye.